I just want to let everybody know that we are recording tonight's webinar so that the students who weren't able to make it, they have access to this and can learn from it in the future. So welcome everybody. My name is Bertil Badal. For those that don't know me, I'm the Director of Diversity at AMSNY. And I'd like to welcome everybody to our Diversity in Medicine webinar series. Before we begin, I just want to put it out there, as we have been doing, we are putting out a call for nominations for our guest speakers. So if you know of someone inspirational, a great role model or mentor, please contact Jenny or myself. This webinar series is meant to be for you and by you. So we do want you to take ownership, and we encourage you to take leadership, and you know best who's out there. So as you'll learn from tonight's talk. Okay, so a little bit about the format briefly. I'll go ahead and be moderating this session. And I want to put this out there that this is a conversation and not a presentation. So we want you to engage. For those that have not participated in these before, engage throughout the talk, ask any question that you may have, use the chat to type your questions, and I'll call on you to ask your question, okay? And when we do call on you, go ahead and introduce yourself. Let us know where you're from, the post-bac program you're in, or if you're already in medical school, where you are and what year you are. And that way Dr. Holden and everybody else can get an idea of, where people are at and who she's speaking with, and it can be more tailored. Okay, I do also quickly want to mention that Jenny Tassler is also here from AMSNY. Jenny, there she is. For everybody that doesn't know her, she's my partner in crime for these webinar series, but she's here to help and enjoy as well. All right, with all that being said, Dr. Holden, thank you for joining us tonight as our guest speaker. It is a pleasure to have you with us. Usually we ask the guest speaker to give a brief introduction of themselves. However, this is a special occasion as our guest speaker actually has been nominated by one of you. Ms. Rakaya Batts, the one with smiling big now, she's a post-bac alumna and now she's a medical student, will be doing the honor. And Rakaya, if I can ask just 3 things from you. If you can please introduce yourself. Tell us why you chose to nominate Dr. Holden for this webinar series. And then the third, go ahead and give the stellar introduction.
Okay. Hi, everyone. Can everyone hear me okay? Okay. So my name is Rakaya Batts. I'm a second-year medical student at the Jacobi School of Medicine and Biomedical Sciences at the University at Buffalo. I participated in the post-bac program in 2017. And you said the second thing was say why I selected Dr. Holden, right? Okay. So I selected Dr. Holden because of the role she's played in my own life as a mentor. My journey to medical school was not linear, and I didn't have the best direction until I found mentoring in medicine and Dr. Holden. The program gave me the proper guidance I needed, and most importantly, it helped me to believe in myself. I gained experience networking in a community of like-minded peers who I'm still in touch with today. And then I'll move into the introduction. So Dr. Lynne Holden earned her BS in zoology from Howard University, graduated from the Temple University School of Medicine, and completed her medical training in the Jacobi Montefiore Emergency Medicine Residency program, where she was selected as chief resident. She is a professor of emergency medicine at the Albert Einstein College of Medicine and vice chair of diversity, equity, and inclusion. She has served as a co-chair of the Albert Einstein College of Medicine Admissions Committee for 13 years and in various leadership positions over 24 years in the Jacobi Montefiore Emergency Medicine Residency program. This is the largest training program in the country. Dr. Holden is the co-founder and president of Mentoring in Medicine Incorporated, MIM, a national health and science youth development program founded in 2007. The mission of MIM is to expose, inspire, educate, and equip students to become biomedical professionals through academic enrichment, leadership development, civic engagement, and mentoring. Dr. Holden has published extensively and received numerous awards for her work, such as the Society of Academic Emergency Visionary Educator Award 2008, the Robert Wood Johnson Foundation Community Health Leader 2009, Washington Post Root 100 Leader 20, the Lifetime TV Remarkable Woman 2010, American Medical Association Inspirational Physician 2016, and the United Hospital Fund Distinguished Ceremony Community Service Award 2019. It's my pleasure to introduce you to Dr. Lynne Holden.
Wow, thank you. I appreciate that. It's good to be here, and we call Rakaya the mayor, so she can laugh at that one. But it's great to be here. And actually, I would like to know a little bit about you all before you start asking questions. So maybe we can just take a few minutes and you can give us your I guess your vital statistics, where you're in school now, and where you were born and raised, and where you went to college, and maybe you can popcorn it over to someone else. So I'll start with the other MIMer, Danya. You want to?
All right. So I'm Danya Contreras. I was also part of MIM. I went to Cornell University. I was class of 2013 under bioengineering. I was born in the Dominican Republic, but I was raised in the Bronx, and now I'm doing the post-bac here at Buffalo, but I'm going to start at SUNY Upstate in the fall. And I'll pass it over to Emily.
Hi, my name is Emily. I went to undergrad at Stony Brook University. I graduated with a Psych BS, and like Rakaya, I didn't have like a linear path into my profession. So I also went to Columbia to get a master's in neuroscience, and now I'm in the post-bac program, and I will be going to Einstein College of Medicine fall of 2021.
Okay, I'll look for you. Okay.
Next is Jerlyn.
So hi, my name's Jerlyn Garrow, and just like Emily, I'm going to Einstein once I finish the post-bac program here at the University of Buffalo. So I was born in the Dominican Republic and raised in the Bronx, and I went to school at Hobart William Smith Colleges here in Geneva, New York, and majored in biochemistry. And yeah, I don't know what else.
Right.
Okay.
Yeah.
Well,
Anxiously awaiting you and Emily when you get back to the Bronx. Nice.
Yeah. So I'll pass it to Dominique.
Hi, I'm Dominique. I also went to Howard University for undergrad.
HU?
You know.
All right.
I was a psychology major there, and then I'm from Long Island, New York. And then I did a post-bac at the University of Pennsylvania. And I'm now in the Med Scholars program at SUNY Upstate, and I'll be going to medical school here in the fall.
Nice, very nice. Oh, Dominique, I think the only person that hasn't gone yet, Savannah, and I guess you all know Jo already. So we'll let Jo introduce herself really quick, and then Savannah, you'll go, okay? Oh, Jo, you're muted.
Hi, everyone. I'm sorry I'm late. Luddite, technical problems, but I know you all, I believe, and it's great to see you. And all I can say is Dr. Holden is an amazing person, and you will learn a lot from her today by asking questions.
Thank you. And Savannah.
Yeah, hi, my name's Savannah. I was born and raised in Rhode Island. I went to Northeastern University in Boston where I studied biology. Now I'm a part of the post-bac, and I'll be going to Albany in the fall.
Nice. Okay. Congratulations, everyone. Great, great job. Great job. So ask away.
Okay, so I'll start it out, but again, I have a list of questions here, but this is your show. So as I get going, please interject and take over completely. All right. So Dr. Holden, how did you know that medicine was your calling?
Well, it's interesting. I think it was really television when I was younger. When I was growing up, there was a show called Marcus Welby, MD, that took my fascination, and another show called Rescue 911, and another show called Quincy, ME. You may know of Quincy, but probably don't know of the former two. So it was really watching that TV show that I saw, albeit a white male, who was doing what I wanted to do. And it's funny because in retrospect, when I would tell my relatives that I loved this show, they would say, well, what about Nurse Julia? Don't you want to be like her? She looks like you. Don't you want to be like her? And I said, well, no, I actually want to be like Marcus Welby, MD. And so that was really my my introduction into sort of this, I guess, fantasy world of meeting lots of people, making them feel better, and being able to interact with them. And then Rescue 911 was basically what it says, it was an ambulance crew riding around and encountering different scenarios and always dumping them off in the emergency department. So I didn't really see the emergency department piece, but I did see the, things happening on the streets and how the response was with that. And then Quincy, ME, that was another show I really liked. And that was, all about why did the person die? And Quincy was a pathologist, but he was always solving problems and solving the mystery. And so between those three shows, that really got me excited about medicine. I had a very supportive family, even though no one was a physician. I did have a nurse in the family, my aunt, and I would say a school doctor, my other aunt, who was an elementary school teacher. So she saw everything in her 50 plus years of teaching elementary school. But I didn't have any physicians in the family. And my physician, although he was an African-American male, he was very much interested in like your weight. You need to stop eating. You need to do that. So I couldn't engage with him about, my career and what I wanted to aspire to, because he was always kind of literally focused. It's funny because I was going through some papers when I was a child, recently, and I got an award at Temple. They gave me like the whole Netter books for something. And I remember telling him about it. And then he wrote me a note. And the note, he said, P.S. I didn't know you were so smart. I'm like, you were my pediatrician for years. What do you mean? But, I have that note. He recently passed away at the age of 95. But I thought that was an interesting, sort of turnaround to my relationship with him. But it was really my aunt who introduced me at the age of 13 to Dr. Muriel Pettioni, who was my first mentor, and also Dr. Melissa Freeman. And it was really through their taking my hand. First of all, I saw someone who looked like me, who was in the community, who was making a difference. And I said, wow, if they can do it, I can do it. And honestly, they went from mentors to past mentors to sponsors. And then now, when they became 90 or so, I was kind of helping to take care of them. So it was really a lifelong relationship that started when I was 12 years old. And then I kind of propelled that and kept, moving, in the sense that there were six summer programs that I belonged to. So starting in high school, which is where I met my husband, at Carnegie Mellon, there was a summer program for African Americans interested in science and engineering. So I went to that program in 1982, and literally every summer afterwards, I was traveling across the country, just going to different programs to experience research at NIH and Tulane and Cornell. And so, I developed all these networks and just got more and more and more experience. So it was an interesting journey. And I actually entered Howard on a 6-year BSMD program, 2 years of undergrad and 4 years of medical school. But after the 2 years, of which I spent in Founders Library, Dominique, I really didn't get out and experience Howard and all of its riches. And so I dropped out of that program, to the disappointment of many, but I felt that I really needed to take those 2 years and grow. And grow meaning, I was coming from an all-girls white Catholic school for 7 years to Howard, which is like, males and all Black folks. So it was kind of the opposite. And instead of hiding in the library, which was good because I got the work done, but I wasn't, growing socially and emotionally. And so the last 2 years, I took the time to really take courses that interested me, explore Washington, D.C., learn about social justice issues, do research, pledge a sorority. So I really, had fun those last 2 years, and then went to Temple for medical school.
I mean, empowerment. I don't know what to say to that. That's incredible. Thank you for sharing the story. I think
Sure.
oftentimes, we hear about people's like expertise, but we don't get the backstory. So, okay. So, and then jumping a little bit ahead, you left off with entering medical school. How did you end up choosing emergency medicine as your specialty? And what factors did you consider?
Right. So, again, going back to Rescue 911 when I was small and, Quincy and always wanting to solve problems, I think that was in the back of my mind. And when I went through my rotations, third and fourth year, because that was during a time where you sort of had, sitting on your rump and for 2 years. And then the last 2 years is when you got into the ward. So you didn't see patients for the first 2 years. I decided that there wasn't, I loved everything. So I felt like, I can't do, I can't be a cardiologist and just do cardiac caths all day, every day. I can't do this all day, every day. I really wanted, some spice, right? So emergency medicine, although it really was not popular back when I applied, it actually was very unpopular. And those who worked in the emergency department were those who couldn't get jobs anywhere else. And emergency medicine residencies were about 20 years old then, but still were not very popular. So I really said, well, what is it that I could do? I couldn't do something all the time. So I said, emergency medicine is great. And then I had a mentor, Dr. Fred Kaufman, and just a little note, I think it's important that you realize that along the way, I've had many mentors, and some of those mentors have become sponsors and sort of introduced me to their world and really hurled me forward. But Dr. Fred Kaufman was very interested in my career. He didn't look anything like me. And, he adopted me, as have many who don't look like me, and really helped me to understand what emergency medicine was and that I fit in emergency medicine. And so the whole premise of not knowing any of the patients or their diseases when they come in the door, the premise of not knowing who I'm going to be working with on my team, the premise of I don't know, what tests I'm going to have to interpret, CAT scans, MRIs, blood tests. That to me is exciting. Some people would drive them crazy, but that to me is exciting. And, behind all the chaos, we call it organized chaos, there's a method, there's a strategy, but I think one of the things with emergency medicine is you have to know what to listen to, because there are lots of bells and whistles and screams and moans and, all types of other noises. And you have to listen, first of all. You have to know what to listen to, and you have to know what to react to. And so that's the type of challenge that I think people who, especially coming out of medical school, first starting residency, is something that they have to master. But yeah, it started with television, and it just grew over the years.
Amazing.
So I'm very sorry to hear that you didn't mention Dr. Kildare as one of your. He was the first doctor I saw on TV, was Dr. Kildare.
I think we're dating ourselves, Joe.
So it's like just, yeah.
So, Geraldine, before we get to your question, just by a raise of hands here, how many of you are thinking about, is emergency medicine a possibility for you? Okay, 2 hands, some eyes, some eyebrows. Okay. Okay. So Geraldine, go ahead and please ask your question.
So the question I have for you is it's great hearing about how it was in getting here, to this point for you. But what has been any difficulty that you have faced, and how have you handled it? Did you experience any imposter syndrome, dealing with rejections? Because as part of my journey, I dealt with a lot of rejections. So it's how did you handle that, and how did you what advice will you give people that face that?
Yeah, I think that's a powerful question, Geraldine. And I saw Rakaya nodding her head and some other folks nodding their head. And yes, I have dealt with imposter syndrome and rejection. I will say that I come from a strong spiritual background. And I do believe that if one door closes, there's a bigger one that's going to open. You just have to be in tune with, you know, yourself and God to find out what that is. So as far as imposter syndrome, you know, when I was in medical school, there weren't many people that look like me. So I think there were maybe 12 African Americans or people of color, you know, and the rest, there were 182 in my class. So on the wards, for example, the people that look like me were the ones who were in the cafeteria or environmental services. So, you know, I make it a point to get to know everyone. And, you know, I may be 10 minutes early for work once I get to the parking lot, but by the time I finish greeting people and finding out how their kids are, and, you know, as I'm walking down the hall with, you know, folks who are just who are cleaning or doing whatever, I might not get to work like half an hour later, you know, so I really have to gauge my time. But, you know, I really try to develop a rapport with everyone, even the parking lot attendant. And I think that has been a real source of strength to me, because even when I'm in those situations where I may be the only one, and, you know, sure, I've had plenty of situations, just knowing that, you know, the girl who's the young lady who's, you know, at the front desk is watching me, security has my back, you know, that type thing is really, really helpful. So I definitely encourage that wherever you go, you get to know all the players and, you know, really take an interest in them, and, you know, they'll return it a million times over for you. That's number one. Number two, you know, again, one door closes, it may be the door that you wanted, but it may not be the door that was meant for you. So, you know, just looking at it from a different lens of, okay, I didn't get this opportunity, but there's something bigger that's coming. So I have to continue to prepare for that opportunity. And trust me, every opportunity that I have not gotten, you know, I can tell you, mentoring in medicine, grants I have not gotten, something bigger or some other opportunity came along the way. Okay, so you really just have to kind of ride the course and keep the faith, so to say, when it comes to that. I'll give you an example of kind of some more recent situations. So yesterday, for example, so, you know, when we're in the emergency department, we have a lot of gear on, right? So a person may see our eyes only and our ID. And there was a patient who is an African-American female. And she came in with abdominal pain, you know, a little complicated history because she had been on antibiotics for a couple of days, and the pain started and got worse. So of course she needed to have a more thorough workup for that. And, you know, I spoke with her, got her history, got her physical, did the COVID swab. Now, you know, that's up close and personal. And, you know, went back to tell her about her results, check on her, see how she was doing after I gave her some pain medicine. And she just, because, you know, the emergency room was crowded, she had to wait for a CAT scan, which she definitely needed. You know, she just went off and she's like, "Who is my doctor? I have not seen anybody since I've been here." I was like, "Oh, come on now." I went over to her and she was like, "Oh, you don't have on the white gown, you have a yellow gown on." I was like, "Oh, okay, that's why you didn't recognize me. That's why. Okay, well, now I'm here." You know, so you kind of have to say, okay, now really, and keep moving. I had another incident where a Black female, again, she's like, "Oh, I don't want you, I want a white doctor." And, you know, on shift that night, there was myself, there was another African-American male who actually had gone through mentoring in medicine who was an attending, and there was an African-American female who was on the critical side who was very occupied. So she said to me, "You know what? I really don't want you. I want the white guy over there." And I told her, I said, "Listen, you're free to have whoever you would like take care of you when they're available." I said, "But I'm going to tell you, he finished medical school about 5 weeks ago. I've been doing this for about 30 years. So you tell me who you want to take care of you." And I said, "And the bottom line is it's my license. So I'm going to have to see you anyway." And then she was like, "Oh, okay." So sometimes you just have to kind of politely set people straight, you know, with a smile, and just keep it moving, not let it affect you. You know, you have that armor, you just bounce off it. You know how Obama, he did kind of this type of thing. So, you know, you may have these sort of insults hurled out at you, and you just sort of just brush it off. And the last example I'll give you, when I joined the admissions committee for Einstein, I was first kind of tested by being an interviewer. And then once they found out I was okay at that, then they invited me into the inner circle. And I remember I walked in and it was this long table and no one looked like me in there. And of course, I was like inside, very anxious, but, outside smiling, went in, and they're like, okay, you can sit over there. And I remember one of the older deans, white male, said to me, "Oh, kid, you're going to be joining us?" And so, I was like, and I said, "Yeah, Grandpa, I'm going to be here too," and just turned around, took my seat. And for like 15 years, he was Grandpa. So, you just have to kind of ride with it sometimes, and you can't let it bother you, because it's going to happen. You have to anticipate it and just keep it moving.
Thank you.
Sure.
So Dr. Holden, you've actually touched on some of the questions. You're flowing perfectly. And Rakaya, right before you asked your question, this is kind of like a coupling question. Again, you've touched on some of these. What are some of these barriers that you are finding yourself facing, whether it's like stigma, pay, support and resources, and are you able to serve your patients in the way you had imagined you could? And then I think Rakaya's question kind of nicely couples with that. Rakaya, go ahead.
Oh yeah, hi Dr. Holden again.
Hello.
So I've always been interested in emergency medicine for similar reasons that you said. I feel like I would get very bored doing one thing every day. I have seeing the most patients that I possibly can in a diverse population. And also because the lifestyle is appealing to me. You do shift work, and so there's a certain amount of shifts you can do per week because they're 12 hours. But something that I've read about in EM is burnout. It's not as high as other fields like neurology, but can you speak to that if you've experienced burnout, as an attending, or if you've seen other colleagues, or how you would rate it in comparison to other fields in medicine?
Sure. So I will say that the joy of emergency medicine is we do not work, we just see patients, right? So they can pay or not. We don't have any privy to that. We just see patients. And so that, to me, that cuts out a lot of immediate barriers, because I don't have to worry about the pay. I just have to get the chart done. So that's an interesting barrier right there, learning about documentation and how to document properly. I will say that in the emergency department, of course, you have to have a very good sense of yourself, your value system, and also a high level of social and emotional intelligence, because you practice verbal judo and, kind of mental games with people to get them to stay when they don't want to every day. And, you have to let people know that you care about them. That's why you're there. You're there to help them. You care about them. So yes, I understand you have X, Y, and Z going on at home, but you also have a mass that I palpated in your stomach, and I don't know what that is, so you really have to be able to relate to people, again, to listen to them, to let them know how much you care about them, even though you really don't know them, but they came to you and you're there waiting for them. You're going to have, say, nurse, doctor, nurse, there's always going to be some conflict on shift, right? So you just have to be able to manage those conflicts, and just deal with it. It's kind of part and parcel of the situation. I would say that probably my biggest challenge, honestly, was dealing with COVID. We're, as you know, on the front lines, and back in March, all people knew March, April, May, June was, there's this terrible disease that's killing people. And honestly, yes, we've dealt with Ebola. We prepared for Ebola, although we never saw a case of it. We prepared for MERS, although we never saw a case of it. We had cases that we suspected because by the textbook, it traveled, they had symptoms. But honestly, when COVID hit and it appeared and came like a tsunami at our front doorstep, that to me was a reckoning, a personal reckoning, with mortality, with, is this something I really want to do? I can get out now and we'll eat tuna fish every day. I don't know, but, I really was, I was at a crossroads, honestly. And after a lot of prayer and meditation, I really said, well, yes, I signed up for this. This is something I wanted to do since I was 6 years old. So I'm not going to run from this. I'm going to take it head on. So, I really had to get my strategy down pat. So, what is it that, how do I put my, PPE on? I wear extra PPE. how do I deal with patients? I wipe down my station. You know, there are little steps that I take that thankfully have brought me this far without getting COVID that I will continue to take. You know, I take supplements, vitamin D, anything I could hear about that may help COVID in the studies. For example, something came out, like Osea did about Pepsid. Pepsid may help COVID. Of course, you know, that hasn't been proven, but I remember saying to my husband, listen, we have to go to CVS and get all the Pepsid there is, because if something happens to me, I need to start taking Pepsid. He was like, you're crazy. So it was that sort of, you know, angst. And I was very anxious going to work because, you know, we're like upfront intubating them. And, you know, many of my colleagues got sick. And, you know, I knew I was in a high risk category. So, you know, you're seeing people around you getting sick, essentially doing the same things you're doing, seeing patients and so forth. You know, you're like, well, when is it going to happen to me? And so, you know, that really sort of woke me up. And I really started getting my ducks in order, you know, the will, the life insurance, the this, the that, because I said, gosh, you know, you just don't know what's going to happen. I will say that emergency medicine, while there are people, you know, burnout is common, you know, because it's a very busy environment. It's very chaotic. You're juggling a lot of balls at the same time. When you're at work, I think they did a study that, you know, like every 8 seconds, the attending, you have an EKG, you have this, someone's calling you for a stroke code, you're doing this, you're hearing a presentation, you're seeing a patient, you know, something's always happening. So it's very busy. So burnout is common. I will say that the joys of it are that it's shift work. And so, you know, that you're there for 10 or 12 hours. You may have 4 hours of chart work to do afterwards, but you know that you're there for 10 or 12 hours. And so, you know, I kind of have a mental preparation before I get there. I do, you know, my best. And I know that when I come home, I can sleep, right? I don't have follow-up, so to speak. And I don't have to worry about so-and-so took the medication. There's some other department, the follow-up department does that. So the other thing with emergency medicine and the way I've structured it is, and when you're in academic medicine, is that you can take on other jobs that interest you. So you can teach at the medical school, you can do research. You can do community service, you can do policy. So there are other things that you can do that sort of break up, you know, that constant, you know, seeing patients. Although you do have a certain number of hours that you see patients. So for example, for myself, I see patients on the weekends, Friday, Saturday, Sunday, Monday overnight. And then I work on mentoring and medicine during the week. So, you know, come Monday or Sunday, I'm ready to do, you know, mentoring and medicine and sort of that slow pace stuff. Come Thursday, I'm like, I gotta get back to the ED. So, you know, I'm in that sort of routine. But yes, burnout is a real thing. And I think also that, you know, burnout occurs because people don't take me time. Like, you know, I'm famous for taking a day off. You know, I just woke up from a nap. I'm gonna be honest with you. You know, I could sleep and take a couple hours, take a walk, you know, go to the, you know, nail salon and, you know, really just, you have to take care of yourself, right? And you have to take a break, and you have to know when you have to take a break and just walk away, rejuvenate, sit down with the book. Something else I really like, paint and sip. You know, you can't do it now, but, you know, find hobbies that you like to do and indulge in those hobbies. The great thing about emergency medicine is you have time to do that. It's all about time management. Always, everything really comes back to time management. So once you master that, you're good to go.
So our post-bac scholars are learning excellent time management skills. So
Nice.
they're well on their way.
Great, great, great.
We have Emily, who has a great question to ask you.
Hello again. So I have a question, and so I know that sometimes people ask us like, oh, do you see yourself opening up a private practice, or do you see yourself working at a hospital or something like that? And for you, as a woman of color in medicine, I wanted to know, how do you know like when an institution is meant for you or right for you? And like, how do you feel comfortable there, or what makes, let's say, this institution feel like home? Is it that they have like the same values as you? Like, what is it about like your workplace that keeps you there?
That's a great question. So I will tell you that I started at Einstein unofficially when I was a fourth year medical student. I was part of a program where they brought diverse students to the campus to experience the campus. And so I was really immersed in the environment. So I think number one is, you have to feel comfortable there. You know when you don't feel comfortable. When I say feel comfortable, I mean, you really don't feel comfortable, or maybe you're around a couple people that don't make you comfortable, but overall you feel comfortable. So you know what's best for you, okay? Number two, realize that every place has politics, right? So-and-so doesn't like so-and-so, so-and-so, you can't get involved in the politics. You really have to focus on why you're there. Take care of patients, or, whatever it is. So, I would say stay away from the politics and just do your job. And if you encounter something that is very disturbing or you feel uncomfortable, take the right routes to to address that. Don't sit on it and let it brew and brew and brew and build up. But definitely you want to be able to do that. And then lastly, get to know people. A lot of it's just about the people that are around you. So separate from the politics, get to know the people and develop camaraderie with the people, other people who are in your class. I know you'll be at Einstein, other, not only your class, but also all other classes. If you're interested in, say, orthopedic surgery or whatever you're interested in, start making inroads into that department so people get to know you, right? We have plenty of students who they're interested in emergency medicine from day one. During the weekend, they're in the emergency department shadowing. And so they're allowed to do that. Most schools, even though it's COVID, I'm sure they'll let you do that. Or if not that, let you come to lecture. Most of the lectures are virtual. So try to get involved early in whatever department you may be interested in. And if you're interested in a couple of them, that's fine too. But you want to start building those connections so that you can, year by year, of course, you're focusing on your studies and the boards and so forth, but you really want to be able to network and meet people who are going to mentor you and sponsor you and be able to recommend you when someone says, hey, ring, ring, we have Emily here. She's interviewing with us. What do you think about her? And the person says, hey, you know what? That's my girl. She's been with me, since day one of medical school, and she did research. Everything I asked her to do, she did. She did research. You want that sort of, phone call to be made about you, not, oh, who? So, you have to start that takes time, but, it's definitely something that you have to work on. But once you develop those relationships, you'll start to feel more comfortable also. And then there'll be a selective few people where you'll say, these are the people I can talk about when I'm having a problem. So seek those folks out too, because they're going to help you when the going gets rough.
Okay. So Danya, you're on point, because actually, again, perfect segue. As we've heard, Dr. Holden is a leader wearing multiple hats, multiple responsibilities. And as Rakaya informed us, at Albert Einstein College of Medicine, she's the Vice Chair of Diversity, Equity, and Inclusion. So before Danya asks her question, I'm going to preface it with one other question. What does your role entail? And especially now in today's climate, what kind of impact has your work had on the efforts at the medical school? And then I think Danya's question is a really important question. Please, Danya.
Yeah, so to piggyback off her question, which is very good, just wanted to know how you deal with like the politics in academia, specifically in your role as vice chair, because I've heard of doctors who get involved and then because of the politics fall off and like decide to just practice. So just wanted to know how you handle it and your thoughts on it.
Sure. So I will clarify, I'm the Vice Chair of Diversity, Equity, and Inclusion for the Emergency Medicine Department. So it's not for the whole school. That's Dr. Baronsfield. God bless her. It's for the Department of Emergency Medicine, which is quite large, but it's not as large as the medical school. So let me just back up a little bit. So when you're in academia, you go through different stages: a clinical instructor, assistant professor, associate professor, and full professor. In emergency medicine, nationally, there are about maybe 50-ish thousand folks who are practicing emergency medicine, who were trained, board certified, practicing emergency medicine. Out of that, when I became a full professor in 2018, there were five African American females nationally. I was the fifth one. Okay, I was the fifth one. And if for you mentoring in medicine folks, the mentoring medicine co-founder, Dr. Yvette Calderon, became the first Latina full professor in emergency medicine nationally in 2015 or 2016. So that tells you about, it kind of goes to what you're saying, Danya, that, you know, when we, Black and brown people, are in academia, most of us are clinical instructors, assistant professors. And we really need to work with those who are assistant professors to become associate professors and full professors. And that means that they are more involved in the medical school, in the region, and nationally, as far as giving talks, performing research, doing other activities, teaching, for example, at the medical school. So there's a lot to learn. Yes, you know, once you become a doctor, that's when, you know, more learning has to take place. There's a book called How to Win Friends and Influence People by Dale Carnegie, which I think all of you should read. It'll probably take you literally, you know, 4 hours of that. How to Win Friends and Influence People. It's very simple, but the tactics that are taught in that book are actually key tactics that I use every day. And those are tactics that help you to navigate that political scenario and to be intentional about how you approach people to get what you want. Okay, so for example, I wanted to, hello Nika, how are you? It's good to see you. Another MIMer there. So, you know, for example, I wanted to do research with someone, and you know, that person was hard to reach. So I really kind of broke them down through constant, you know, contact with them through those techniques. And finally the person said, yeah, you know, come on, do research, be my partner, whatever. That helped me to get to a full professorship. And, you know, in mentoring in medicine, we deal with so many partners that it's very, you know, you really have to kind of wheel and deal in a sense, and really, you know, work with them, work together with them. So that's been a real challenge, but also, again, you know, the book, I mean, everything, honestly, I can tell you, the book was very helpful in doing that. But I think that you cannot focus on the politics. You have to focus on what it is you're trying to do. And, you know, if you're hampered by the politics, yes, you know, address it. But otherwise, you know, I think if you're kind to people, don't talk about people behind their back, you know, you do all those great things and people see you're genuine in your heart and what you want to do, then everything will be fine. Everything will be fine. And, you know, a lot of this path of advancement in academia is having a mentor who's going to help you to do that. And so because there's so few, you know, of Black and brown people, you have to, you know, and I said it before, you have to go to other people to help you, and they will do it, but you just have to ask them. And with you know, with a heart of, please help me, you know, I'm here to do what it is I have to do to get to the next step. So How to Win Friends and Influence People by Dale Carnegie. I'd highly, highly, highly recommend it.
Noted. Thanks. Jenny put that in the chat. There's a link to the book, so check it out. So we've got a question, two questions, one from Dominique and one from NECA. And they're somewhat similar, but I do want to, you should both ask them because maybe they are a little different. So NECA, I think you contacted, please go ahead.
Hello, Dr. Holden.
Hello.
Long time no see.
I know. It's good to see you.
Yes. So I guess I just wanted to get your opinion. I feel like you might have talked about this at some point, but I want to know, and I'm not even going to bother looking at what I typed, but I just wanted to know how did you, even as a student, set boundaries? I know Mr. Morrison, he's a successful man, but like not everyone around me, for example, you know, has like a business mindset or understands, you know, how much dedication goes into studying, for example. So how did you set boundaries as a student and even now in your career how do you set boundaries with people who may not understand, what, you have to do as a student and of course as a physician?
That's a great question. So I would say that first of all, you want to find out who your supporters are, right? So in your family, there must be some folks, one person, your neighbor, your church mother, someone, who supports you. They may not know what you have to go through, but they are supportive of you. So that's the person that I would lean on when it comes to, helping to navigate your particular situation. The other thing is that, it goes back to time management and saying, okay, I know you want me to, go to the store, for example, or you want me to do the laundry, for example, but I have this test. I'm laser focused on these courses and passing this, these tests and doing well in these classes. And when I finish studying for 2 hours, sure, I'll put a load of clothes in and then I'll come get them when I finish my next 2 hours. So, really just being open with people and saying, listen, this is what I'm going through. And it's interesting you would say that Nneka, because I guess since you were in mentoring in medicine, we started something called Parents Who STEM. And the idea is for parents to partake of and listen to health professionals and scientists so they can hear what their child is up against, right? So it's often the parents that ask the most interesting questions because they didn't realize, oh, they have to pass that test the first time. Oh, so I think, letting your parents in on, maybe even conversations like this, where they can ask questions and where they can, really partake of your life, because, they're probably seeing a little bit and they're saying, well, why is it that she's not acting the same way as before? But they don't know. And so informing them, inviting them to various activities if they want, leaning on that person or people who are your supporters is what's going to get you through and get you by. Sometimes you may have to walk away and say, listen, I need to go to, hotel so-and-so, the Mentoring Medicine Study Hotel for a week. I'll see you later, or something like that, so you really have to be, and that's where somewhere we're working on that. We're not there yet, we're working on it. But, you may have to find a hideout, basically, where you can just, feel safe, study, get your work done, no pressure, be fed, all those great things, and then, go back to that high pressure situation in time.
Thank you.
Sure.
Dominique, I know you had a similar question, but please go ahead.
Hi, so my question was about what's your advice to like us students of color with setting like boundaries or balance in terms of like when social justice issues or things that we're passionate about like diversity come into play, balancing that work with like actually doing our schoolwork, because I think I've seen a lot of the times that like the burden often falls on the students of color versus like administration or making it like a collective effort versus like other students just get to study. So I just wanted to know what your thoughts on with that.
Yeah, that's a great question, Dominique. I mean, a lot of things are happening in the world that affect, are affecting you mentally and socially and physically. And, I'm always a firm believer that you are in medical school, on the way to medical school to be a doctor. And so don't let anything stop you from that. Your friends may be going to, protest at such and such a place, but guess what? If something goes down and you're with them, they're not going to care. Everything you worked for to this day is going to be erased if something bad happens. And we see in Miami, we saw with all the protests, bad things happen, right? People might have gone there for peaceful reasons, but bad things happen. So my advice is keep your behind at home and study and really try to, that's your focus. Serena Williams said when something happens, she shows them with her racket, right? So she works very hard at perfecting her craft, tennis, and that's her form of protest. So I think your form of protest, there are a lot of people, everyone has a different role, right? Everyone, they're people to go out to the street, they're people to write letters, they're people to do, everyone has a role, and I respect everyone's role. But you have to understand that your role is you've made it this far. You want to make sure that you continue on that path okay? You don't want anything to deter you. And if you think of, I'm a mother too, right? So I think of all these things that could happen, you could just, this could happen, that, So all my kids at Mentoring Medicine, I'm like, listen, you just study, laser focus on studying and passing those tests. That's your form of protest, because we need you to take care of lots of other people. And you're a rare breed. There are not that many of you. And like I said, you made it this far. You don't want that to be totally erased in one incident. So when you say set boundaries, yeah, the boundaries are, listen, I'll pray for you. I'm going to, I'll send a letter. I'm going to be here studying, and without my TV, without my iPad, nothing, because nothing is going to stop me from walking across that stage, getting that MD and walking into that residency program, so I can take care of many people who, yes, I can address it then, but right now I'm on a set, predestined, preordained path, and I want to keep that, moving and be the best that I can absolutely be. No distractions.
Thank you.
Sure.
Great. You're sharing great words of wisdom, and I think you're probably an excellent role model. So
thank you.
To probably switch, let's talk about your program, Mentoring in Medicine. This is a national health and science youth development program that you founded in 2007.
Co-founder, yes. No, I didn't do it myself.
Co-founder.
Yes.
Co-founder. So tell us a little bit about your program and what is it that you strive to accomplish with MIM?
Sure. So the program, again, was started in 2007. And because I was the product of 6 pipeline programs, I sort of saw the lessons learned in each of them. And one of the biggest lessons learned was there was no continuity. I always had to search out the next program and the next program. So I wanted a program that had continuity, number one. Number two, we started with college students coming into the emergency department, and they seemed to fall off into this black hole. And so I was like, oh my gosh, so we had to develop programming to really start younger. And we ended up starting in elementary school because, habits of learning, building intellectual curiosity, learning how to read, learning the vocabulary, all that starts very young, and it's built over a course of time. The other thing that was very important to me was that the family was involved, because I felt like people in our situation, a lot of times their family, as Nneka was saying, they don't know what you have to go through. They know you have a dream. They know you want to be a doctor. They're really happy about that. They're really pushing you, but they don't know what it takes. So involving the family is very important. So early on, I did a focus group study about perceived obstacles to achieving a health career. And for students, number one, it was confidence, lack of confidence. And so we work very much on confidence. Most of our students have been told no in some way, somehow. And so we work very hard on erasing that movie and playing the Yes, I Can movie. It's very important that whatever happened in the past doesn't determine your future. So, you got to keep it moving with new strategies that you develop, new people that you meet, new places that you go. And anything you can do to try to achieve your dream. So we do a lot of that dream building, confidence building, social and emotional intelligence building, in addition to, for example, MCAT prep and academic enrichment. Because a lot of our students in the younger grades, middle school and high school, they're in underserved public high schools in urban cities. So we tend to do activities that help them to read, learn math, public speaking. They don't know it, but we embed that into some of their content. So for example, at Adelphi University, we had this past weekend a Save a Life e-poster contest. So students had to get into groups and meet people students from all over New York State got into these groups. They met people they had never known, somewhere in middle school, somewhere in high school, somewhere in college. And they had to work together to decide a name for their group, then decide a cause that they were going to research, and everyone had to research it and come up with a poster. And I mean, it was amazing. In an hour and a half, you should see some of these posters that the students came up with. And the topics ranged from the effects of sitting too long, the effects of, watching your, being on your cell phone at night, how that decreases. I mean, I learned things from them, so of course, mental health issues with COVID, but it was just amazing. And so, that's what we try to do with students, and let them know that they're loved and we believe in them. We see them not as they are, but we see them when they're successful. And so letting them know that it is possible. You, even though you may not think you're going to be successful, we know you're going to be successful and we believe in you. So let's do what you have to do, and we're there to support you. So mentoring in medicine, our goal is to increase the number of competitive applicants to health professional school. And it's a little sentence, but it's a tall deed. But that's what we're dedicated to doing. And I like to tell Andrew, we have lots of kids. After I had my daughter, I almost died actually, and had something called postpartum cardiomyopathy. And I'll never forget when Andrew and I got married. He's like, "Oh, I want to have lots of kids," and I was like, "Oh, that's great." And then we have our first child, and the doctor's like, "If you want kids, you want to be around." So, after that, we said, okay, our kids are going to be the kids we have in mentoring in medicine, plus, of course, our daughter, who's now married, for those of you who knew her. Yes, she is. So yeah, it's been a labor of love, certainly. But it's been, the benefits that I reap, especially now, seeing Rakaya, Neka, Danya, inside I'm crying because I knew where they were and now I see where they are. So it's really, it's very heartwarming.
They're a testament. Oh, Rakaya.
Yeah.
They're a testament to the program, Yeah, so that's amazing, Lynn. I was trying to get this question worded and it didn't quite come out well here. So hopefully I can tell you what I'm trying to ask. So now that you've shared with us a little bit about MIM, what you do, why you do what you do, and what the program accomplishes, given all that in context, is there advice that you have for the students here listening, that when they become the doctors, the leaders, the advocates of their communities, is there an ask? Like, is there something you want to embed in their life philosophy moving forward in the context of your work with MIM?
Of course.
Okay.
No, you're on point. You're very much on point. So I would say there are three takeaways, I guess. The first one is don't forget where you came from. You are on a different path, many of you, than the rest of your family members, but they were there to support you. They love you. And although you may not, relate to them in the same way, and you know what that means, go to family dinners, be at family gatherings, check in on people, take that time to, check on that deacon or deaconess that looked in on you, so really don't forget where you came from. Number two is reach back. So, there are many things you can do to help the next generation, just your showing up at school, just your, talking to your patients. You may have a patient that comes in and they have a child with them, just engage that child. Hi, how are you? What do you want to be when you grow up? Taking an interest in them. They'll remember that for the rest of their lives. So, really reach out to the younger generation, and you'll have great teachable moments moving along. Make sure you use those teachable moments. And lastly, your community, you can advocate largely, and you can advocate, I want to say on a smaller scale. But for example, my patients, they may come in for, a stub toe, but if their blood pressure is high, that's a teachable moment. I had a patient the other day who came in for shoulder pain, benign shoulder pain. It wasn't anything alarming, but I noticed his blood pressure was high, and he confessed, "Listen, I don't take my blood pressure medicine." And I said to him, "Do you know that blood pressure is the silent killer, high blood pressure? More Black men are on dialysis, tied to a machine 3 days a week, 4 hours a day, because they didn't want to take their blood pressure medicine." So, those sort of teachable moments, especially coming from someone that looks like them and knows, their cultural background, really makes a difference. It really does make a difference. So I would just say, stay involved with the community, take advantage of those teachable moments, reach back and engage, little ones, and whenever you can. and maybe not so little ones, but engage them, encourage them, and don't forget where you came from.
Let that sink in for a second. Meanwhile, any last minute burning questions? I just want to be mindful of people's time. Yeah, I'm with you on that.
I don't have a question, but I had a comment, if that's okay.
Of course.
So I just wanted to say that I thought the questions asked tonight were really insightful and had a lot of foresight. I was very impressed by them, and I don't mean that in a patronizing way, because most of you guys are post-bacs, I believe. And before med school, I just thought that med school was going to be hard academically. I didn't think that it would be hard politically or racially, but those are real challenges that you will confront. And I think it's great that you're starting to think about those things now. And the comments that Dr. Holden made were very helpful. I would just say, reach out to the people that know you and can encourage you. Stay grounded, and medicine has a long way to go in terms of changing, racially, and it's an old boys club. And as Dr. Holden said, you will start to get used to it a little bit. I know that sounds bad, but it won't affect you as much as it initially does. And I think it also depends on the environment that you're in too. Those of you going to Einstein, I know there's a lot of great support there for minority students. So, don't worry about that. Anyone who's going to Buffalo, just message me on the side. I'll prep you. But, anyway, good luck. And yeah, I thought the questions were great.
Thank you, Mayor.
Lynn, do you have any other final words?
No, I think, I'm always open if you want to chat, or if you have a problem. Rakaya knows that. So always willing to sit down with you and hear you out. For those of you, coming to Einstein, I'll inevitably bump into you, and definitely come visit me in the emergency department on the weekends. And yeah, just I'll put or I guess, Bertel, you can send my information to the students. I'm always willing to talk. I prefer to talk before you feel like going onto that cliff. So let's if there's a problem brewing, let's talk sooner rather than later. And yeah, I'm so proud of all of you. And like I said, I see the future you. So great things are happening in the world despite what's going on otherwise. And I just want you to stay the course and hang in there.
Thank you. Thank you, Dr. Holden, for an engaging, very engaging and real conversation. I think that's one of the advantages of these webinars, is just having real conversation. So really appreciate it. Before we say goodbye, I wanted to ask the group, Rakaya made a comment, it's an old boys club. Want to point out, Jenny pointed this out actually, this is Women's History Month. And if you look at your screens, we've got a screen full of amazing female leaders, future doctors, you name it. So if we can take a picture of empowerment, if anyone's opposed to that, feel free to take off, remove your video, but otherwise I would love to take a screenshot if that's okay.
Sure.
Okay, all right. So here we go. I'm gonna count this down. Smiles here, 1, 2, 3. And one more, 1, 2. Excellent. So Rakaya, we're changing it.
It is changing, Rakaya. It's changing.
It is.
Yes.
It's taking some time to come to Buffalo, but.
So Lynn, thank you very much. It was really, really wonderful, very inspiring, and you're just a fantastic role model. So thank you for doing this. And, as Rakaya said, Bertil said, for just sharing your wisdom with everybody, with the knowledge of everything that you've gone through. So,
Well, thank you. There's many more things we can talk about, but I know we're time compressed, so would love to talk more. And thank you for the opportunity, really. Really means a lot to me to see all of you and to hear from you and to hear what's bothering you, what's on your chest. You know, it's very important for me to be able to help you work through it, because, you know, been there, done that, and you don't have to, you know, go through it alone.
All right. With that, I will conclude this month's webinar series. Look out for the next one. It'll be in about a month. Jenny will probably be emailing out, and we'll go from there. Everyone have a great evening.
Okay, thanks everyone. Take care. Thanks, Rakaya.
Thank you.
Thank you.
All right, bye-bye.
Bye.